started to look at my background with lifestyle, nutrition, healthy habits, and interpreting the blood work on that end versus what they were seeing in medical, functional medicine, and a little bit more on the nuance and fringes of kind of what's going on in the space today.
You know the feeling. You're exhausted, your gut feels off, your weight won't budge, your motivation is gone, and then you finally get labs done, only to be told everything looks normal. But you don't feel normal. And here's the truth we're saying out loud today. Normal labs don't always mean optimal health, and they definitely don't erase what you're experiencing. This is especially true for women who are far too often conditioned to push through, minimize symptoms, and be the most critical person in the room towards themselves. That's why I'm excited about today's guest, Joe Miller. He's the founder of First Optimal, a functional medicine and health optimization company known for combining advanced lab testing with high-touch coaching to help people get their energy back, improve gut function, and finally make progress towards hormone health and weight loss. Very similar to what Modern Endocrine does. They've helped 10,000 plus people optimize hormones and body composition through advanced labs and expert care. In this conversation, we zoom out and talk about health in general, how progress isn't just about willpower, and how being hard on yourself can keep you stuck in the same cycle. We also talk about why it matters for women to speak up when they don't feel well, especially when the standard workup doesn't give clear answers. And we get practical. Joe breaks down how coaching can be the missing piece that turns information into transformation, and how tools like GI map gut testing can reveal issues that routine labs may miss, helping you make targeted changes that actually move the needle. So if you've ever felt dismissed by normal, if you've been blaming yourself for symptoms you can't explain, or if you're ready to take a smarter, more supported approach to hormones, metabolism, gut health, and weight loss, this episode is for you. Let's get into it. So I wanted to start today by introducing you guys to Joe. I'm going to have him tell us a little bit about what he does, his backstory, because you guys know as listeners, I love a good backstory. I think that it helps us, learn the people that are going to speak to us. So he's going to give us a little backstory about what he does, and then we are going to talk all things gut, hormones, thyroid, metabolism. So tell us your story, Joe.
All the fun stuff. Yeah, thanks for having me on. So I got started in this a little bit of I would say an untraditional kind of path, but I'm finding the more I talk to, there's this little thing called COVID that happened that maybe caused some people to change direction. So originally I went to school for I would call it human performance. So nutrition, training, exercise, etc. I grew up in a pretty large health brand and climbed the corporate ladder and was went from the fitness guy to the dusty old suit guy in the office. So learned a lot about the industry, the business, all that, but saw a lot of gaps as far as, how we could really help people when you run into these roadblocks and you need a more aggressive intervention. And so fast forward I was there in that industry about 18 years, same company, and COVID happened. And in Michigan, it was shut down. I think they were the fourth or fifth last state to open back up. So I was fortunate where I was not furloughed, but I was, definitely scared I'm going to lose my job, if you will. And I had a friend who started a clinic, and it was a little more heavy male. I would say more of TRT for men, probably 3 to 5% women. And throughout that time and throughout my experience in the fitness industry, I just, men certainly need help, but I think as a man, I can say this, I think it's a little more straightforward, and there seems to be a lot more, well, not seems to be, there's a lot more, as I'm sure you know, research around men. I think it was even until 1977, the FDA didn't even allow women in any trials, which is crazy. And so I saw a big gap in the women's health space. That got my attention. So while I'm at this company, the health company that was shut down, I started consulting in the telehealth industry, and got really into going to a lot of these conferences and trainings and talking with folks in the medical field, and started to look at my background with lifestyle, nutrition, healthy habits, and interpreting the blood work on that end versus what they were seeing in medical, functional medicine, and a little bit more on the nuance and fringes of kind of what's going on in the space today. And in comes my wife. So that's where the story kind of pivots for us and where First Optimal was birthed. So my wife started doing some work with us. We brought her in, working with a brilliant physician, and she had low estrogen production, but estrogen dominance symptoms. So I'm sitting there going I'm not a doctor, but the math isn't math in here. So what is going on? So the doc was brilliant, did his best, but was limited in his testing. He was only using blood work, and a lot of pretty smart physician and going deep on blood work. But what I found was, when she started therapy, she kept having a lot of the estrogen dominant symptoms just weren't rampant. Really, and was like, this is not for me, type. She walked away kind of defeated and really struggling with it. And I said, this just isn't right. And so I was at a conference back when precision analytics was newer. So they were starting with like somewhat newer. I don't know their full when they officially started, but Dutch testing was, kind of, from my perspective, newer. So we ended up doing a Dutch test, and I really nerded out on that for a couple of years, and some of the nuances of it, and found there were some things wrong with like her pathways as far as how she methylates and clears some of those hormones, which was causing them to kind of recycle back into the body, and that's what's causing all these issues. And so I bounced around from there to I was a minority partner in that clinic. But now I was hooked. Like, I was really passionate about this, and I felt like, hey, this can help men, but like women are really underserved here. And I have 3 women, my wife being one of them, that when the commercial says less than 2% of women get this symptom, my wife is less than 2%, like everything. So that she takes. So I said, I'm like, okay, like I have to figure this out. So, and I couldn't do it alone, I knew. So I did a lot of consulting in the space, was a part of a couple different organizations. Finally, a lot of people I was working with, they were very, very supportive and said, you guys need to start your own. Like, you have a different approach. You have a different market you're trying to serve. We're just staying in our, blood work, 80, 90% male treatment. And if you're a woman who doesn't have any of these issues like gut health or the ability to kind of metabolize these hormones effectively, you're going to get great care from them. But if you don't, they're going to refer you somewhere else because they just weren't interested in exploring that further. And so fast forward, about 2 years ago, a little over 2 years ago, we started First Optimal with a blend of functional health coaches and providers that were like-minded, and, started really looking at the deeper layers of what's going on in one's body. Why are they low? Can we fix it? And if we can't, and there still needs to be a prescriptive or medical intervention there, how can we find a minimum effective dose so it's easier on the pocketbook for them? So if I'm talking to investors, it's really not a great conversation at first. And I said, no, they'll be with us a long time because we're doing well. But there's that piece, and then there's also, as like the poison, if you will, is in the dose. If we can find the minimal effective dose for people, it's putting less strain in their body. Body has time to absorb it, metabolize it, adjust to it. And for a lot of these women, it's like it's almost like they're going through, for some, if they're perimenopause, not so much, but menopausal women definitely they report it's almost like they're going through puberty again. And so they're getting a lot of those symptoms. And if you don't know how to dial it in, and those the margin of error in women is so small compared to men when you're getting in there with hormones, that I felt like we really need to do that. And so at this point now, like our practice is roughly 75% women, 25% men. And we get a lot of referrals from more complex cases, which is, exciting to see, and kind of just saw that gap in the marketplace and said, okay, like let's dive in here. And we're still working through it, and we love a challenge, and we're still adding to our team people with different like nuance expertise to fill gaps. Or maybe we're good at it, but we're not great at something. We're like, well, let's get great. Let's go find the people that are great, hire them to train us, or bring them on our team and provide that service. So that's a little backstory on me and why I'm here and all that fun stuff.
So you said a couple of things that really resonated with me as a perimenopausal woman who takes care of perimenopausal and menopausal women all day. One of them was, you said women are a little more difficult to treat than men. And I would say that is true. Didn't necessarily word it like that. But, if you're used to taking care of men in general, it's just a little easier process because you guys don't convert estrogen and you don't have all these issues like we do. Like your wife has this clearing metabolism. So she's got either phase 1, phase 2, or phase 3 estrogen detox issues, or maybe, several. And so it is a little more straightforward taking care of men. And so I do think that it's really cool that you found a passion like, hey, women are being underserved because we have been for years, because we haven't been studied, and we used to stay at home and our lives used to be different. So that's one thing that you said. I thought, yeah, that's very, true. And then you also made a comment about, wanting to continue to like just explore things and become great and, fix people. And I think that that's also something that's just kind of missing in today's healthcare. It's almost like after COVID, I don't know, just things were different, right? Like, but trying to find what's actually wrong with someone, get to the root cause of it, give them the minimal amount of medication or whatever they need to actually help fix their body and get them better. I think those are both, just very powerful things. We need more of that in this country. There are so many sick people, right? And, some women will be able to go to that provider you were talking about, and they don't have gut issues. They don't have, significant hormone recycling issues, and they'll be better. But I'm going to tell you, as a woman taking care of women, that's not very many people. That's not very many women. Like, most women now have gut issues, right? We have stress issues. We have, hormonal recycling issues. If we haven't seen a doctor or seen a provider like you have, or been in this space, just because of, I think it's our life, right? It's so crazy now. Like, we're under lights all day long. We're on our phone. Things are beeping at us. We don't sleep like we used to. The stuff we call food is not really food. It's just, there's so many different things that are driving all this. So I think it's just really cool that you decided, hey, I'm going to change. I'm going to, take this unfortunate event that my wife had, and I'm going to turn this into something good. And I'm going to create, it's one stop optimal, right?
First optimal. Yeah.
First optimal. Sorry.
Yep.
First optimal.
Oh, that's okay. I get that a lot. So I guess I wasn't thinking through the spacing when we put the name out.
You should have written out the word first. First optimal.
Some people do. Some people still do, but
yeah. And so I think that that's really cool, and that you're just really passionate about, like, how do I bring providers together and help service people throughout the US. So I think that story is very neat. And you said that you guys do a lot with hormones, right? Tell me what else First Stop Optimal does. Like, you guys do thyroid management, you do like hormone management, you do gut management. Kind of tell me about your concept and how you guys feel like we should be taking care of people in this space.
Yeah, so really we kind of do a blended approach depending on the person. So I'll answer the question, but I think to set it up a little bit, we try to meet them where they're at. So some people may come in and it's just like gut health, and we know from their blood work or their symptoms, like, you have a lot of hormone issues too, you have insulin response issues, you have blah, 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 blah. And they're tied. That's the little secret you're trying to get them to know and accept that, because, a lot of folks won't realize like how much brain fog could be tied to their gut health or hormone production and things of that nature. So we try to, when someone first comes in, really spend a lot of time from we call them like our care team, which is like non-medical. So they're more like the functional health coaches. Just, it allows us a lot more time, and it's a little bit lighter on the client. And when they first come in, because they're kind of a client of the health coach and a patient of the provider. So they get both. And so they spend a lot of time to dive into lifestyle, symptoms, obviously like a pretty robust like health history information, and then trying to figure out like what's the best way forward. Like that, sometimes that depends on their willingness to engage, their financial constraints, or just their understanding. So if someone's kind of ready to go, we usually are looking at the largest barrier first and then working from there. So meaning, if someone's coming in and we can fix, say, gut health, for example, or we can assess that first, and then working from the gut, out as well. And then other times we try to look at, where is this person mentally at? So a lot of women will come in and it's like, I'll explain how they come in, and then I'll give my anecdotal thoughts on it. But so they'll come in and they're just like, I need symptom relief. Like, I'm not playing around. Like, we need to get some relief now. You can do all your tests and do what you need, but I need help now. And so that's where it really, it's a good challenge for the provider to figure out, okay, like, what can I do for this person to help get some relief while we're treating some other areas which are probably causing it. So it's a little bit of a blended approach, I see. And it's also, I find, the support system for specifically for women coming in, and as well as the mental aspect, seems to be driving a lot of the issues as well. Meaning, if you look at like women today, I think you mentioned earlier about different phases. I remember, I'm going to forget her name. She was the COO of Facebook. I heard her speak once. Anyways, the point was, of course, it's going to come to me in like 5 minutes. She was talking about the analogy, the story she told was her husband was at home because she's the CEO of Facebook working. So, busy executive and taking care of the family. Husband brings child to school and it's green shirt day. Child has blue shirt on, and all the ladies at the stop at the drop off say, "Oh, mom forgot that it's green shirt day." And it's like, no, like dad forgot. Dad's owning this. So I think as the roles in the household change, there's still this societal like pressure and expectation around being the mom and the housewife of the 50s while being, Miss Bad boss, if you will, and like running the show out there in the corporate world. And I see it like with my wife, because she grew up with the 1950s mom, but she was a Division I athlete or a college athlete. She would, more go, 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 likes to be challenged. And so I think a lot of it's like also when they come in outside of the medical is just acknowledging that, letting them know and trying to help them find like space in their life with their therapy. Because if you're just cramming a bunch of therapies with somebody and they're not changing lifestyle, stress management, finding some space in their life, which it does take time for a lot of people because maybe they're just, indoctrinated in this kind of way of thinking and way of living, they're going to have issues. They're going to burn out because, I'm sure you've seen it too, where it's someone walks in and you're like, what are you taking? Like you got 18 supplements, like what are we doing here? So, we're supposed to be supplementing a couple things that are missing from your diet or whatever the case may be, or if they're on a more aggressive protocol. But if you're doing it year round, like it's time to call a timeout and figure out what's going on here. What are we overcommitting to? So I think that's, from my point of view, at least, the lack of studies and research for women's health up until probably the early 2000s started to pick up. And as you know more than I do, a lot of that research doesn't really hit the medical schools for 20, 25 years, and it starts getting layered in. So unless you're passionate on the topic as a provider, not that they're inherently bad providers out there, they're trying, that's the system they're in. They're trying to run their practice and maybe don't have as much of the knowledge or resource to help women navigate through some of these issues. And so I think that's where the approach of like functional medicine comes in. And there's a lot of great practitioners out there, a lot of great people doing it. I think our style works. I think other styles work too. But what I always come back to, it's all about time and understanding the individual and then walking through what barriers can we remove and then what things can we add in to help as they kind of navigate forward, if that makes sense.
Yeah, I mean, it's all a balancing act in life, right? I think all the points you brought up are good. It's, can you maintain taking 18 supplements for the rest of your life? I mean, right. You might be able to, but like, do you want to? How stressed are you going to be, right? And so what can we do to help mitigate you taking some of those? Like, what can we do from a lifestyle perspective? And we have a very similar approach. We have health coaches who really try to set with people and figure out like, hey, like for instance, I saw a lady the other day and she's got a ton of complaints, a ton of concerns, a few significant health issues. But, on her intake form, she's like, I sleep 4.5 hours a night. And I'm like, okay, how long have you slept 4.5 hours a night? For 7 years. I'm like, well, I'm going to be really honest with you. It doesn't matter what supplement you take. It doesn't matter what hormone I give you. Until you sleep more than 4.5 hours a night, we're not going to get very far here, right? Like we just aren't. Like you're not Superman. I'm not Jesus. Like there's nothing I can do here to make this better. And so I think it's really important too. A lot of times things are missed in medicine because we just don't ask the simple questions of, are you sleeping? What is your nutrition like? Do you feel safe in your home? Do you have unresolved trauma that we don't know about? Like just little things like this do you move your body every day? Do you see the sun? And so spending time with people to have conversations like that. And then, having health coaches figure out what can we do to make your sleep from 4.5 hours to 5 hours? And then how can we go from 5 to 5.5? And how can we go, to 6 so that we're not giving you additional things that can cause side effects that aren't going to fix the actual underlying issue, right? And unfortunately, you said something that made me think about this. Medical school, not to discredit medical school or school or any school that anyone goes to, because I went for 13 years of higher education, but you get indoctrinated in that higher education. It's very like, if this, then this. This is caused by this. You treat this disease with this. It's almost like a cult. It's like you will prescribe medications to make all these things better. And not saying that you don't ever need a medication. I'm also not saying that. There are life-saving medications that are needed, but we don't learn in that indoctrination cult called medical school that, hey, the body is actually the system of systems and we don't always need a pharmaceutical drug to make it better. What we need to do is figure out, why is everything not functioning well? Are we getting enough water? Are we getting enough sleep? Do we feel safe? Like these are all just important things that when you go to traditional medicine offices, they either don't understand because again, they got the indoctrinated medical school nurse practitioner training. And that's just, nobody goes to medical school or nurse practitioner to be facetious or be bad. It's just, that's what they were taught. Yeah. Or they've never stepped back and really thought about it. Because if you and I are having this conversation, right? As human beings, we all know, I hope if you're listening to this, you understand you must have water in order to live. You need air, you need a clean place to live, you need to feel safe. Like there are things you need in order to live and function as a human, but somehow we forget that when we walk into doctor's offices which is just kind of crazy in my opinion. And I think that providers are so busy and they have 15 minutes to see you. And when they don't know what to tell you, that indoctrination that we got in school was somehow you fix it. And so if they don't know how to fix it with a prescription, then something's wrong with the patient. And then they're like, well, you're fine. Everything's fine. You're stressed. Right. And that's not the truth.
No, I mean, I think you make a lot of great points. I mean, and I'm curious what you experienced too, but a couple things I wanted to comment on was like ballpark here, but I just like part of our onboarding, we look at what is it roughly 80 to 85%, depending on the research or the stat you look at, of the general CDC health guidelines that a given population is just not doing. And if you start with that, like you just mentioned, like water, sleep, protein, fiber, resistance training minimums, step count, activity, like just starting with that basic. Cause like I was talking to a menopausal woman last week. I just happened to answer the phone line and she's like, well, that seems really generic. I was like, yeah, it is. But you're not doing it. So do it first. It doesn't cost you anything. I'm literally saying, we'll give you all these guides for free. Don't spend a dime with us. Start doing it and talk to us and then go from there. And then as a conversation progressed, I started to briefly mention like, hey, and this is what the provider will tell you. But if you walk after meals, like this is how much it'll impact blood sugar. If you do this, this is how it'll impact that. So all this stuff isn't just like someone was sitting in a corner office one day and said, oh, I think everyone should walk this much or everyone should lift that. It's there's really pretty solid data to back the positive health outcomes, these basic things we'll have. I mean, you look at some of these influencers that are making millions of dollars like now, and they talk about sunlight, hydration, sleep. You're like, man, why didn't I think of that? So it's kind of funny because I don't know how many Huberman episodes you've listened to where that's where they're just going deep on those topics. And I'm not knocking it. I think it's just crazy how we want to like romanticize about some magic pill or magic thing, and it's probably more of a societal thing than an individual thing, but it's just like no, just do those and start. And then I think to your point about the medical system, like my primary care, love him, but the main thing I really like about him is he's just a humble guy. Like if I bring something up and ask him, he doesn't know, he's like, I don't know, let me check. I have no idea. Like he's like, I wasn't trained in that, let me see. Or hey, you should talk to this person. Like he's not like, well, Joe, it says here you're fine, so just scoot along. It's like, let's have a conversation about this. It's so I think the model itself, to your point though, is like they have a standard of, you know better than I do, but they have a standard of care. They have certain restrictions, if you will, of things if they don't say, they could be opening themselves up to a liability in some cases. Again, I don't know from personal experience, just kind of things I've observed, but I also think the model itself is more designed for sick care, which, hey, if I'm sick, great, let's go there. If I break my arm or leg, that's where I'm going. If I want to be optimal, not going there. Like, not a chance. I'm going to go to someone like yourself or, search out these other options. So
that's 100% factual. Our traditional healthcare system in the United States was built on you being sick. If you are ill, if you break your hand, your foot, get in a car accident, get shot, have a heart attack, or having a stroke, we got you, Right. But if it's like, hey, you're not feeling great, but your labs all look normal. And by normal, I just want people to understand what normal labs mean. Right. When somebody says your labs are normal, that means that they took 100 people in the general population and they took their blood. They mapped it all out from lowest to highest. They cut out the 2.5% lowest percentage, the 2.5% highest percentage of that lab value. They crammed the rest of it together and said that's normal. Yep. That they did not take into account the people that they tested were actually normal, were actually well, that's just how they do it. That's how they make normal lab values. Okay. That's not what I want. Like that's like a D- in my opinion. And so when somebody says your labs are normal, that does not mean that they are optimal by any stretch of imagination. And actually, if you go back and look at lab values in this country, like for instance, our liver enzymes, right? Our liver enzyme cutoff used to be around 18 or 19 for AST and ALT. Now it's 32 or 36 because everyone's liver enzymes are in the 20s. And so they're like, well, not everyone can be abnormal, so I guess we'll just move it. Yep. The problem with that is everyone's liver enzymes are in the 20s because everyone has fatty liver disease, because everyone is insulin resistant, because we are not a healthy country. That doesn't mean we should change the normal and just let everyone be, everyone's normal, but they're really not. And so it's just very frustrating that if you're not feeling well, normal, your labs are normal, that shouldn't be the answer. But again, I think that's what's indoctrinated in people in school. And it all goes off of these guidelines, like you say, like my society, the Endocrine Society writes guidelines. These are supposed to be the end all be all, but I can tell you 50 million problems with their thyroid guidelines, right? I can tell you tons of problems with their hormone guidelines. These guidelines aren't updated every year. It costs a lot of money to do studies. People aren't going to pay for studies when they're not going to make money off of the studies. And so there's just so many issues in healthcare, and we don't ever take into account, like there wasn't one time in med school, Joe, where anyone ever told me, hey, Dr. Cassie, when patients tell you something, you should take that into consideration. There was never a class that was like, well, when a patient talks to you about a symptom, you should listen to that. It was always like, if this, then, and so it's just very disheartening when you get out into the world. And because I did it, I went out into the world and I was like, I'm going to do everything they taught me. And I went to traditional medicine and I did everything they taught me. People don't get better. They get worse. You give them more medicine. They gain more weight. It costs more money. And so, but when you actually start listening to people like your health coaches do and your providers do, you're like, oh, this makes sense because the last 85 people that came in here said the exact same thing. And when I told them to sleep more, and when I told them to, walk after they eat, and when I told them, to try berberine or whatever you want to talk about, it actually worked. But that's just not what we're taught in school,
No, and I think that's a great point. I wanted to share a story with you and see if you experience this sometimes too. And again, I think some of this has to do with the personality type, so I'll preface with that. But I have my sister-in-law, actually. She was working with a friend of mine who does not work with us, but she's a awesome health coach. And she had a target. She's a little bit, taller, larger frame, et cetera. So let's call it 140 grams of protein. And she's just like, on this protocol and blah, blah, blah. And she was like, I'm only getting 80 though. I'm only getting 80. And like super stressed and freaking out the whole time. And I'm like, have you talked to your coach about that? She's like, well, no. She said, I need 140. I'm like, okay. But if we can take the first 2 weeks and go from 80 to 85 and then work our way up to 95 and then get to 100, I was like, would you feel better? She's like, well, yeah, I'd feel better. I was like, is that reasonable? Could you do it? She's like, yeah. And I'm I don't do coaching. So I'm just having a zoomed out conversation of all the pressure she's putting on herself. I was like, do you think maybe in 6 months you might get to 120 or 140 grams? Yeah. I was like, and if you share it with your coach, do you think they'd be on board with that, this plan and sharing your struggles? Yeah, I guess I didn't really think about that. I'm like, that's okay. Like, it's kind of like, I think sometimes too, there's this defeated shaming, personal shaming, like I don't even know, maybe others can comment on this. So I don't know if it's everyone else's shaming them, but, oh, it says 10,000 steps, not a chance in hell. I'm never getting that. It's like, well, could you get 2,000? Because you're doing 1,500 right now. Could you get 2,000? Then could you get 3,000? Like, these are guidelines. These are, so now at least there's people like yourself and others that are like really taking that traditional awesome foundation of like how the body works and everything, saying, hey, how can we apply this? And we're giving these top of the line outcomes, hit this, and this with your fiber, your water, your blah, blah, blah. But people are so far away from it. I think I'm just, assuming this, but what I gather is they're so far away. It's like almost like their stress gets higher and their defeated mindset gets higher that like, I'm just going to give up. And it's like, no. You had 3 grams of fiber. Now you're doing 10. This is good. Let's just stay on that train. Like, let's keep working through that. And I think that's where maybe the lack in the current medical field just doesn't give the space and time to do that coaching, if you will. And you don't have to have like the old whistle and the hat on and the coach like mentality, just guiding someone through it and letting them know this is okay. This is where you are today. This is where you'll be tomorrow. This is where you'll be in a couple weeks. Like, just painting that brighter future for them down the road and just stay on the path. I don't know. I just think that helps a lot because I'm sure you see it too, but a lot of the women we interact with, it's just like, the smallest misstep. And it's like, oh, here we go again. Like I'm a failure and I can't do it and it sucks. And it's like, no, it's wow. Like, give yourself a chance here. You got 20 years of poor habits, not blaming you. Like, life happens, circumstance. May take us a couple years to unpack this, but let's just work through it.
Yeah. I think that's a great point. And I think, if patients are listening to this or providers are listening to this, that's a good point of talking to people, and I'm probably guilty of this too. Like, hey, you need to eat 140 grams of protein, where you need to say, okay, well, how much protein do you think you're getting? You're getting 50 grams. Okay. Can we get 60? And then, can we get 70? Because to your point, a lot of times we are our worst critics. I truly believe that. Like, we really are. Like, I've been in the gym before and I go to the gym a lot, right? I'm that person that if you go to the gym and you've never been to the gym, I'm going to come up and talk to you because I think it's really cool if you go to the gym, and I know it can be intimidating, but you have to remember that like somebody lifting a 30-pound dumbbell wasn't just, they didn't start lifting a dumbbell, right? They started at 2 pounds just like you. Professional athletes, we look at people and think, oh my gosh, they didn't start doing that. They started by just like swinging, a bat without even trying to hit a ball. And so I think it's really important that people remember everyone starts somewhere, right? And the other thing, the gym analogy, I used to never go to gyms because I was like super terrified to go to gyms and like lift weights. I thought people cared. Nobody's looking at you in a gym.
Nope.
Nobody cares what you're doing at the gym. Like they're just trying to do, and the same thing with life. Like I think a lot of times we think, oh, they're judging me, or nobody's judging you because they don't have time to judge you. They have their own demons, their own issues, and if somebody is spending time judging you, that's like the 5% of humans that just suck and are really mean. And you shouldn't waste your time on those humans anyways.
Yep.
I mean, just my opinion.
Well, yeah, and
Gonna throw that out there.
yeah, and I'll probably screw up the quote, but I tell my daughters this to the effect of like, if you wouldn't take advice from them, then why do you care what they think of you? Like that small percentage of people you really care, you would take advice from. If they say, hey, like I really think you should be a better husband or whatever, someone who I have that rapport with, okay, I'm gonna listen. But everyone else, go pound sand. I don't care. And I can tell you, because I'm not a massive human being, but I'm about 6'3", 245. I like to think I'm in decent shape, and I started yoga about 4 weeks ago, and like all the women are like, who's that dude? So it's always nice when my wife is with me because at least I get a little less stares, but I'm like, I don't care. Like I'm here for my health. Like, I can't really flow through my emotions as smooth as all them, but I'm doing my deal. I'm getting my jam in, so I have a bunch of friends. We train like MMA and stuff, and I'll always send them a picture after, just kind of like a little accountability for me. But I'm like, I would just use, for people listening, if you were in the weight room next to me, just because I grew up in the weight room, not because I'm some like, hardcore super athlete, but I'm going to be a heck of a lot stronger than you and have way better form because I've been doing it for my entire life. But I don't care. I'm not even going to notice you. If anything, I would be happy if you asked me a question. I'd love to help you or point you to the trainer that even knows more than me in there. And it's the same like with yoga. Like when I realized I used to do it a long time ago and made a fool of myself, like I thought, and then now I'm doing it again. But now I know like people don't, they're in their own mind. Like they don't care. It's all cool. It's all good. Yeah. So I don't know. I think it just, if people kind of get out of their own headspace and just do it, you meet other like-minded people and you make a lot of friends, and it's really, it ends up being a good experience overall. So,
it would be interesting if we went to yoga together, Joe, because although it looks like I would be a great yoga person, I'm terrible as well. Like I think I lifted weights my whole life, and then I tried to do yoga last year, and it's just so, I just don't like it either. I don't know. Yeah. I don't know why. Maybe, but I just don't. I'm like, this is so boring. And so I'm like terrible at yoga too. I'm trying to do Pilates, but I just get really annoyed. But I can barely touch my toes. So I'm like, this is a problem. Like I need to be able to touch my toes, right? So it would be interesting.
No, I will say like, I don't, like I said, I don't care. I like my wife's there because at least if I get lost, I can look over and like, the woman next to me doesn't think like I'm creeping, so, yeah. Or like the teacher, because I'm like, you don't have to look at me, just flow. And I'm like, I get it, but I also want to learn
no idea what you're doing.
What is that word? The place I go now, they do a nice blend of like, I forgot, what is it, Sanskrit? What do they call it? Like yoga language, and then verse, just tell me what you want me to do. So that does help, understanding the poses or the flows. I do a lot of vinyasa, I do it once a week. I do vinyasa, but yeah, it's funny when you get lost because I'm just like, okay, that's what I should do.
I know. I think that's why I don't like it either, because they get into it and then they're like, bird dog and down dog and like saying all these dogs, and I'm like, what the hell does that mean? Can you tell me what I'm supposed to be doing?
I just laugh a little, but I will say this, like I had the bright idea in my 40s, and this was a really good mental thing for me. I had the bright idea in my 40s to get into like combat sports, like MMA, jiu-jitsu, etc. And so that anyone who's listening, like, go do that, because then you will be the mentally strongest person in your friend group, and you will not care what anyone thinks. Because if you go somewhere every day, and this is going to sound scary, and you have someone that could break your arm, they have you in luck to break your ankle or choke you out, like you realize like this is the most humble, like vulnerable position I could possibly be in. But you also realize too, the partnership, like the partner you're training with is not going to go full out and like injure you. And so you kind of build this camaraderie with it. So it's the same there, like, because it's the opposite there. I walk in, they see a bigger fit guy. They're like, oh, I'm going to tear him up. I'm like, new guy. I mean, I'm not new now, but I used to be like, new guy, totally chill. do your deal. I'm just trying to learn. Like,
Yeah.
because they'd be
Please
like,
don't break my ankle.
yeah, no, and then some of the guys that were like our friends, I call them, they're good friends now, but they're like higher level guys. Like they would have fun with me a little bit and wait to kind of put me out of my misery, but it was still just like, having that establishment. So I guess my point is in all these different like, areas I went into where, fish out of water a little bit. It's just like, no one cares. They don't care. If anything, they're happy. They're happier there, right?
Yeah. And I think that, so I don't even know how we got off on this tangent, but yes. And so that is very true. Most people don't even care about what, we're the hardest on ourselves. And most people aren't even looking at you or putting you under that lens. So if you are, trying to work through something with your health, you're working with a coach, you're working with a provider, and they're giving you expectations or they're giving you goals, and you're like, there's no way I can meet this goal, then trying to figure out, okay, what is the best way to do it? And that if that's working with a coach, if that's talking to someone, I mean, even with the internet today, I mean, you want to know how I would solve that problem? If I was eating 40 grams of protein a day and I needed to eat 140, I would go to ChatGPT or GenSpark and I would say, I eat 40 grams of protein a day. This is what I eat. And I would put all the protein I eat. Help me make a plan over the next 12 weeks to increase my protein by 10 grams a week or whatever, GenSpark's going to spit that out for you in 2 seconds. Yep. And then you've got a plan, Yep. And then your coach can help hold you accountable for that. So there's a lot of ways you can do things. You just have to be willing to do it. You have to be willing to not care what somebody thinks. You have to be willing to maybe fail. But, that's just part of humanity and part of life.
Yeah. I don't, and not to get too far into weeds of nutrition, but just one other comment that you just made that made me think of it is like, I'm sure there's a lot of women out there that are very similar to my wife. So she does not like to be told she can't do something. As soon as she's told that, it's like subconscious, like, oh, I'm going to eat it. Like you're not going to tell me. So she does not like diets, but of course I say it and I'm her husband, which is fine. Like I don't listen to her. She doesn't listen to me. Like, you should have a coat on. No, I shouldn't. And I'm freezing, but others have helped talk to her. But my point in bringing that up is like almost, it's not called reverse dieting, but almost like if you hit like an intake goal, I was like, hey, if you hit fiber, water, and protein, you barely have enough room in your stomach or your hunger signaling to like eat any junk. Like if you just focus on those minimum, points, you're not going to overeat as much versus just blindly going at it throughout the day. And so I find that helps a lot of people too, who maybe struggle with restrictive type eating or like restrictive, whether it's like intermittent fasting or no carb or calorie restrictions. It's like, we'll start somewhere. Like you can start with, if you're taking in this much of a good source, a better source, maybe food isn't inherently good or bad, like I guess better, then you're less likely to eat the stuff that's been maybe sabotaging your gut health, your insulin response, et cetera. So I don't know, seems to be working with some, but I would imagine there's a lot of people out there too that just have that response when it comes to anything restrictive.
No, I think that's a good point because I'm the same way. Like, I don't like to be restricted or told I can't do anything. So I try to, in my life, like if I'm going to try to do something like lose weight or whatever, I'm going to say, okay, what should I be eating? Like, what should I incorporate? Not what can I not have? Because I'm the exact same way. If you're like, hey, you can't have any more cookies, I'm going to be like, I'm going to eat a cookie every day.
Right.
So I think that's more of like filling your life with things that you can do or that are better, and never saying you can never do something is really valuable. I want to ask you from a gut health perspective. I know we talked about this a little bit before the podcast started, but like in your guys' program and when you work with patients, how important do you think gut health is for most of your clients, patients struggling with, brain fog, fatigue, weight issues? Do you find it to be a pretty significant issue? And how do you guys kind of address that?
Yeah, so I would say it's a very, very, very high percentage of the issue that we find. I don't know why we seem to find a higher percentage. I have some speculation on it, but we seem to find a higher percentage of women than men. But we do try to encourage the men to look at that more as well. But I think it's because men just accept it for whatever reason. I don't know. But I do find that once that starts to clean up, a lot of those other symptoms start to subside. From that gut health standpoint, a lot of what we do, obviously, like anybody else, like a questionnaire on what's going on, and then try to make some assumptions on what could be going on with the gut based on the feedback. And then we put them through, like we were talking before, we do a lot of, we're starting to do some upper GI stuff, but we do a lot more. We find like the GI mapping with zonulin, like looking at gut permeability, if there's dysbiosis, different pathogens, things of that nature. We find that approach, getting that test, really helps unpack downstream, issues they're having with their symptoms. Another thing, so I might bounce around a little bit to answer your question, but I'll try to land the plane the best I can. So, because another thing that we found a lot of success with is like doing food allergies and food sensitivity testing. Because I'm hypothetical, so just bear with me on the numbers. But let's say it's going to take 16 weeks to get to a gut protocol to get through it. Well, it might take, half the time. But the reason why it takes so much longer is because they're still eating these inflammatory foods that are like somewhat working against the protocol. Like it's just not as efficient, where if we can remove some things early in the protocol, we're finding more success with that. I don't have a specific like study to reference, more anecdotal experience. It seems the protocols are having more success in a shorter time frame. And then we're generally, I'm kind of painting with a broad brush here, but we're generally like looking at, some kind of like kill phase, followed by like some kind of recovery phase, followed by some kind of like reseal, if you will. So there's 5 phases now, and I'm drawing a blank on the 5 R's is like the traditional reinoculate. Thank you. And then there's one more that
there's reinoculate, there's replenish, there's a phase, there's a repair phase, and there's a remodel.
I have it. I just didn't want to cheat. I should have cheated.
You basically kill. You're right. You kill, and then you usually assist with like digestion, replace, digestive enzymes, etc. Replace.
And that was the thing that we found was like one of the markers. So I'm just going to speak from personal experience because we have a lot of different, client examples that I kind of an arm's distance understanding what's going on with them. But my wife specifically, she's was going through a pretty aggressive like kill phase that she needed, but also noticed certain foods. I want to say I'm trying to go off memory. I think it was low elastase, and I think it was causing her to not be able to digest protein as well. Correct. And so we're using like digestive enzymes with protein meals just by intermittently add it when you're going to have like a animal protein, like right away. She said like literally instantly, and like it sounds like an infomercial for it, but she's just like, nothing works for me. She did it. She's like, oh my gosh, I can't believe like acid reflux is down, like all these other like bloating, gas is so much better. And then after that, moving forward, the one thing, again, I don't listen to her. She doesn't listen to me. We love each other, but we don't listen. So that's a good sign of if you're in a healthy marriage, if you don't listen to your spouse. But fiber, I'm just like, hey, honey, like, I know, but just like putting it out there, all that like dysbiosis you had, and we killed a bunch of stuff. Well, now we got to feed the good stuff. So so she has a coach that works with her that is smarter than me, and she listens to, but I was just trying to like understand, hey, I know you're through this protocol and you got all these like awesome tools at our disposal because of the access we have and the team we have. And so I think of women that don't have them, like, oh my gosh. And then, but let's add in the natural stuff, the normal stuff that got us there. Let's start layering that in. And so those are things that like, she was struggling with, because I'll just use her like, I don't know, you get to double-digit grams of fiber, and she's like struggling with it. And I'm like, yeah, you got to start low and just kind of get the gut to readjust. I think there's some pretty good vegan studies out there where they, if I remember correctly, where they're showing how long it takes for like the gut to adjust to those high levels of fiber. But, and it takes a little bit longer for some than others, I guess is the point of that. And not to like, you can't just jump in. Most people can't just jump in and go from like barely any fiber to 25, 30, 40, 50 grams. It's like, they're going to be like, you're crazy. They're going to be, a lot of distension, a lot of issues there. But I think it's just kind of layering it into that protocol. And then on the back end of the protocol, working on fixing that permeability of the gut. We use a combination of a lot of different peptides and looking at other things that could have been working into that as well. But so we'll use some different peptide protocols that we find, like, your traditional ones that are I'm sure you commonly use to help kind of repair the gut. And that actually did affect her administration, I want to say, of her progesterone. Again, I get the stiff arm. I can't be involved in a treatment. So correct me if I say something wrong that doesn't make sense or the logic isn't there. But I believe we were doing like a troche progesterone they were doing with her like early on and during her protocol. So she could, because the concern was that like too much of like an oral administration with the gut issues was going to be, wasn't going to be as effective, I guess is the best way to say. So I don't know if that was like hey, we're going to try this that way, or if that's like a solid.
Yeah, I think so. Progesterone, like the way you administer it, depends on every person. But to your point, yes, like fiber, I mean, it's something that can take months to reintroduce into your system. And depending on what bacteria you have, depends on how fast you can reintroduce it. But remove stressors and pathogens. Then you replace things like digestive enzymes, stomach acid if you need it. So you were talking about your wife's elastase, which means she wasn't digesting protein very well. So replacing the digestive enzyme is good. But, the caveat of that is if you're drinking 3 Alanis a day and 4 cups of coffee and, eating all these terrible things, it doesn't matter if you replace your digestive enzymes, if you repair your gut. You have to remove those bad things first. So you remove, you replace, you re-inoculate with probiotics, right? Then you repair the gut lining, what you were talking about, like glutamine, things like that. And then you rebalance. So you talk about like sleep and stress, and you can do some of that together, but it is very important to your point because your gut then affects every hormone in your body, right? So when your wife was working on these things, it could have been that her progesterone and estrogen were metabolizing differently
Right.
because of the strains of bacteria that she had, or maybe her thyroid hormone wasn't metabolizing correctly, or her, growth hormone. And so all these things are super important, and just having these tools, like you point out, it's so powerful because little things like a digestive enzyme or bitters or, anything like that can totally change your digestion. But you also have to put it in context of how much caffeine are you drinking? How much sleep are you getting? What are we doing to ourselves? It's kind of like a car. I tell people, like, if I said to you, okay, Joe, here's a Lamborghini. You get a brand new Lamborghini, right? Are you going to run that Lamborghini 150 miles an hour nonstop and never give it gas and never change the oil and never look at the tires and never take it to the car shop and leave it outside in the rain and never wash it? And, no. You're going to treat that Lamborghini like every other man, like it's a human being probably, and take better care of it than you are your child. And then you're going to, but this is what we do to our bodies. Like we treat our bodies just terrible. And then we're like, why are they breaking? Why are they not working? So you have to think about it like that. Like treat yourself, for men, like a Lamborghini, for women, I guess, treat it like a Birkin. Is that bag everyone wants? I don't know. Like something, we have to treat ourselves like we would treat a really nice object. Right?
No, it makes sense. I mean, you were asking about gut health, and I skipped over this too because there's this analogy that I try to use, and sometimes when I'm saying it on the spot, if I'm trying, I might botch it, but I'll do my best. So essentially, I just try to talk to people, especially with like 40 and up. I'm like, do you remember when you were a kid, like the 80s, watching TV and how grainy and gritty like the signal was in the TV? Like, yeah, I was like, how now it's like 4K high def, like the person's like in your, in your living room. Like, yeah, it's like, that's the signaling when your gut's a mess is like the 80s signaling and the picture you're seeing. This is a signal that you have when your gut health is optimal. So when you talk about, there's GLP-1 receptors in the gut. When you talk about digestion, you talk about hormone, metabolism, you talk, the immune system, like you name it, all that stuff is, you want it high def, like clear, crystal clear signaling to the rest of the body and the communication, all that fun stuff. So that, most people in that kind of 40 and up age group can kind of remember those times of the, especially my case, it was grandma's house when she had the knob, because we at least had the remote, but she had the knob TV. So that was rough, but
my grandma too. And the rotary phone. Remember when you put your finger in the phone?
Oh yeah. No, I think my kids think that was like a joke. They're just like, why?
I know.
I'm like, no. Yeah.
Okay. No. So I think, to kind of recap on that, gut health is super important as well. So I want to transition to asking you 3 questions that I ask all my guests, and I don't want you to overthink it. People love this. They love, so I think some people listen to my podcast just to this portion of it, but don't overthink it. First thing that comes to your head. What is one food that you feel is most beneficial and why?
Don't overthink it.
Yeah.
I don't know why I want to go to a food group.
No, you have to pick one food.
I am going to say eggs.
Okay.
Amino acid profile. You can have egg whites and get less fat with the egg yolk. You can blend it so you get some healthy fats. I think that's my reasoning why. It's like the gold standard for amino acids, etc. So
choline. Yep. Lots of people say eggs. What is one thing that anyone that's listening right now can do that will improve their health that is 100% free?
Walk after meals.
Yep.
10 minutes, but if you can start with 2 minutes, start with 2. But 10-minute walk after a meal.
You can do it inside. You don't have to go outside. You can 100%. Walk around your table. I've had people say, well, I live in an area where it's not conducive to be outside. Well, then walk around your table.
Well, and I know you want to move because I'll say this, like, if anyone heard of The Mountain, like the huge powerlifter guy that was on Game of Thrones, his protocol, because he's in like Iceland or whatever, was just to ride a little stationary bike because he couldn't go out and walk. It was freezing cold. So after every meal, he'd ride a stationary bike. He's, world-class athlete, and he's still doing it after a meal. So anyways, I digress. Little fun fact that I picked up from this coach when I interviewed him. So
that's awesome. And then last question is, what is one thing you wish you would have known about your health 25 years ago that you would have done differently?
There's a lot, but I think because of the last year I've been more cognizant of it, is fiber. I think it'd be fiber. I never paid attention. I competed in like physique sports, like protein, managing my carbs, insulin response, but never really paid attention to fiber intake. Would have avoided a lot of gut issues and all the other fun stuff that fiber can do for us.
Probably a lot of like reverse dieting issues too, I would say, after competitions like that. But
Yep.
that's for another conversation. Okay. And then can you tell us kind of where everyone can find you? Obviously, we're going to put all your stuff in the show notes, but like, where are you most active? What do you want people to know about you? Like, how can we help people know about what you do?
So I'm one of those people that's very creative with my name online. So it's Joe Miller, 1-0. So for First Optimal, it's just Joe Miller 1-0. I'm very simple, 1-0 on all social media platforms. I do a ton of educational content because I just really enjoy it. So we have all kinds of stuff we'll send to people for commenting, or we have like flows, or we give out a lot of quizzes, a lot of free guides, a lot of information. I just really like just putting information out there for people to help. So yeah, Joe Miller 1-0, or the company accounts are First Optimal. So that's 1ST, the word optimal, OPTMI. Did I spell it wrong? Firstoptimal.com is our website. And then we also have the First Optimal podcast, which you'll be joining pretty soon too. So
yes,
a lot of good, lot of good stuff.
Sorry for butchering that. One Stop Optimal, First Optimal,
It's all good. It's all good. Like I said, I'm pretty simple with my names. It was just like, well, let's do First, 1ST, Optimal. Our name's a little specific too, because First was like asking people, when's the last time you put yourself first? Call a timeout, take care of your health so you can better serve your friends, family, community. And then Optimal, obviously we want to optimize your health, but another layer to that is we want to optimize your treatment plan, minimum effective dose, best bang for your buck, best results.
Oh, I love that. I love that. Well, thank you for coming on and chatting with me, telling everyone about you, and have a great day. Before we wrap up today's episode of Hormones, Metabolism, and You, I want you to pause for a second and take in the biggest message from this conversation with Joe. If you're not feeling well, you're not crazy, you're not dramatic, and you're definitely not broken just because a basic lab panel came back normal. So many people, especially women, are carrying symptoms like exhaustion, stubborn weight gain, gut issues, mood changes, and brain fog, while also carrying the belief that it must be their fault, that they just need to try harder, be more disciplined, be more consistent, when in reality, sometimes what you need isn't more pressure, it's better information, better support, and a plan you can actually follow. That's why I love today's conversation. We talked about health in a more complete way, how coaching can be the bridge between knowing what to do and actually doing it, and how looking deeper instead of just stopping at normal can uncover what's really driving the way you feel. We also discussed how tools like the GI map can add clarity when your gut is part of the story, because when gut health improves, it can ripple into energy, inflammation, and hormone resilience. And if you're someone who's been minimizing your symptoms or talking yourself out of getting help, let this be your reminder. You deserve care that listens longer than it explains. You deserve care that listens longer than it explains away. If you got value from this episode, follow the podcast, share this episode, and leave a review so other people can actually find it. For more free tips and more gut health advice, follow me on social media at modernendocrine_. If you want to go deeper, check out my new book, Fix Your Gut, Fix Your Hormones. There are links on my website and my podcast about how to get on the list to purchase this. It drops on April 7th. Finally, if you're ready for real support, consider being a patient. We have a clinic in Oklahoma with state-of-the-art treatments, and we also provide telehealth services in 46 states. You can book a discovery call on our website at www.modern-endocrine.com to learn more. Thanks for being here with me today, and I'll see you next time on Hormones, Metabolism, and You. Have a great week.